Gage Primar here, crushbackpain.com. Today we're going to talk about exercises for lower back pain. If this video helps you, leave me a thumbs up below. Drop me a line if you have any questions, and I will do my best to answer those questions. Also remember to subscribe to the Crush Back Pain YouTube channel. Exercises for lower back pain are not all created equal. There's not just one exercise or one group of exercises that are the best for lower back pain. The reason being, there are different structures in the lower back that cause pain. The disc can cause pain, the facet joint can cause pain, the SI joint can cause pain, the muscles can cause pain. So when you're looking at exercises for lower back pain, you want to figure out several things. First of all, you want to figure out if you have what we call a directional preference. All this means is a direction of movement that reduces your symptoms. This is generally most important if you have lower back with leg pain, often called sciatica. So if you have lower back pain that radiates down into your buttock, the back of your thigh, down into your calf, if you have any symptoms like that, you're going to want to see if you have a directional preference. So let's go over that. If, let's say you have lower back pain radiates down into your right buttock, into your right thigh, down into your calf, you want to see if a direction of movement reduces or centralizes that leg pain. So bend forward, you see what that does. If that increases your leg pain, that's not your directional preference. Next, you bend backward. And you can bend backward like this, standing up. Sometimes you have to do it repeatedly. You can also do it on your stomach. Call this a prone press up, oftentimes called McKinsey exercises. But again, you're just going to do maybe 10 or 12 of these, just nice and easy. And you want to pay attention to what your leg symptoms are doing. You want to see if the pain in your leg either decreases or centralizes, which means comes out of the leg and comes up. So if the pain's in the calf, you start feeling it less in the calf and you still feel it here, that's a good sign. If the pain just goes down to the back of the thigh, you do some of those prone press-ups and you feel it higher up in the thigh or just in the buttock, that means it's centralizing. Again, that's a good thing. You want to see if you have a directional preference. If you do, then you're going to want to focus on exercises that put your spine in that directional preference position. So if your directional preference is extension, then you're going to do a lot of prone press-ups, McKinsey type exercises to get the leg pain to centralize. As the leg pain goes away and centralizes, you're going to start to focus more on trunk lumbar stabilization training. Okay? Now, if you just have lower back pain, no leg symptoms, and multiple directions of movement increase your lower back pain. So you can bend forward and feel it. Sometimes people will bend forward and then when they're coming back up to the upright position, they feel it. Bending backward, bending side to side. If multiple directions of movement increase your lower back pain, then you're going to want to focus more on lumbar stabilization exercises. You don't need to worry so much about a directional preference because you don't really have one. Multiple directions of movement increase your lower back pain. Now this is more common when pain is localized to the lower back, you don't have leg symptoms. Sometimes people that have sciatica, that have the leg symptoms, they don't have a directional preference either. When that's the case, they're going to want to focus more on lumbar stabilization training as well. Now when it comes to lumbar stabilization training, you're going to want to choose exercises that engage the core musculature, work on the core musculature without placing excessive load through the discs and facet joints of the lumbar spine. This is especially important because there's a lot of ways to effectively work the core, but if you're working the core and also putting too much stress, strain, compression through the discs and the joints of the lower back, you're not helping yourself too much. You're really just kind of exacerbating the pain generators. So you need to be really careful about what exercises you choose, and that can take some time going through different things and figuring out what you can do and what you can't do. Easiest way to figure out what to do is go over to crushbackpain.com and check out some of the articles over there that walk you through some exercises to start with that we know put minimal load through the lumbar tissues but engage the core muscles. So to recap, exercises for lower back pain. Figure out if you have a directional preference. This is more common when you have lower back pain with leg pain, also called sciatica. If you do have a directional preference, focus on exercises that move your spine into that directional preference position, and then as the leg pain decreases, transition to more lumbar stabilization training. If you don't have a directional preference or you just have pain localized to the lower back, you're going to want to focus more on lumbar stabilization training. It's really important to get the exercises right when you start and do the right things right off the bat, because this is going to set you up for success, opposed to doing exercises that may be exacerbating your symptoms and not helping you at all. And oftentimes this is why exercise doesn't work for people. They're either doing the wrong exercises because they don't know any better, or they may be doing the right exercises but they're doing them wrong. The other important thing with exercise is to be consistent. If you do them for a couple days and you're not really feeling better and you quit, obviously they're not going to work. So you need to be consistent. Generally it takes a good 6 to 8 weeks for exercises to really do what you need them to do, especially as it pertains to the lower back. So it takes time. It's not an automatic fix. Now, the reason exercise is so important with lower back pain is because it's the only approach that has been proven in the medical literature to reduce the likelihood of developing lower back pain in the future. So pain medications, anti-inflammatories, injections, even surgical procedures do not reduce the likelihood of having lower back pain in the future. Only exercise has been shown to prevent lower back pain. And this is huge. The old saying, an ounce of prevention is worth a pound of cure. If you can prevent future lower back pain episodes, you're doing something right. And only exercise has been shown to do this in the medical literature. So it's really important to start with the right exercises, make sure you're doing them right, and then do them consistently. If you have any questions, drop me a line below. This video helps you, leave me a thumbs up. And check out crushbackpain.com if you want to see what exercises you should focus on. And also remember to subscribe to the Crush Back Pain YouTube channel.